Hi everyone. Let's go ahead and take a look at this very last section of our chapter 20, which is section 12. And this is going in and looking at the special circulation in the fetus, and then just a couple of postnatal changes that are going to occur. And we'll get into this a little bit more when we get into growth and development at the very end of the semester. So what we're going to do first is trace the pathway of blood through the fetus. We're going to be taking a look at some adaptations that are going to be found in the fetal circulation, and then we're going to take a look and see what happens to those adaptations after the baby is born. So let's go ahead and take a look at some differences between the fetus and the newborn, specifically looking at their circulation. So you have to remember that there is this organ called the placenta, and the placenta is going to be what delivers oxygen and nutrients to the fetus. The reason why is because if you think about it, where we normally get oxygen is going to be through the air, but with the fetus is going to be inside of the uterus, bathed in this amniotic fluid. So there's not going to be any kind of connection whatsoever the fetus has with air. So in order to get oxygen, it has to come from the mother that's breathing in the air, and eventually that blood is going to get to the fetus that way through the placenta. Also the nutrients as well. So the mother is of course going to eat hopefully a healthy diet, and the nutrients are going to eventually get to the fetus through the placenta that way. So that's going to be one of the big differences, is the fact that the fetal lungs are non-functional. Again, I talked about why they're non-functional, but because they're non-functional, it goes in and changes the pressure in the heart as well. So the blood pressure is going to be higher on the right side than it is on the left side, which is going to be different in, of course, newborns. Another thing is that the liver is going to be non-functional as well. So the lungs and the liver are going to mature a lot later on in development. So that's why there's going to be these adaptations here in the fetus. So again, we're going to be taking a look at some vessels that are going to shunt blood to organs of need, and then we're going to take a look at some where they are going to, it's going to be taken away from those immature organs. So let's go ahead and go through the circulatory route, the fetal circulatory route. I want to point out a couple of things. So here's the placenta, and take a look. Here's the umbilical cord right here. The umbilical cord is going to be made up of an umbilical vein and umbilical arteries. So take a look at what they are pointing to. Umbilical arteries are actually going to be these kind of purplish structures that are going in and surrounding the umbilical vein, which is going to be red. So that leads us to believe that this vein, since it's red, it's carrying oxygenated blood, which is completely correct. So remember, we talked about how veins typically are going to carry deoxygenated blood, but remember, it had that little asterisk, most of the time, but not all the time. We saw that the pulmonary veins did not carry deoxygenated blood, and here in the fetus, the umbilical vein is going to carry oxygenated blood. So the vein is still doing its function, right? Remember that the vein's function is to carry blood to the heart. And that's exactly what this umbilical vein is doing. It is carrying oxygenated blood and nutrient-rich blood to the fetal heart up here. So that's what's going on. So that's where we start, is here at the placenta, and how the oxygenated blood and nutrient-rich blood is going to enter the fetus through the umbilical vein right here. As soon as we get up here close to the liver, we have our first adaptation, or first shunt, and it is going to be called the ductus venosus. This ductus venosus is going to directly connect that umbilical vein to the inferior vena cava, and what it is doing is it's shunting it away from the liver. Remember, I talked about how the liver is immature for most of the fetal life until later on, whenever it becomes later on in development, is going to mature. So that's our first shunt right there, is dumping it into that inferior vena cava. And when it does that, look, it's highly oxygenated and it's mixing with deoxygenated blood. So you kind of get this purplish colored blood, which is going to be where it's a mixture of oxygenated and deoxygenated. We still have oxygen in there. We didn't lose any oxygen. We just went in and mixed it with some deoxygenated blood. All right, so we're going in and moving to the right side of the heart. So that's where the blood enters in, just like ours. It enters into the right side of the heart, the right atrium. All right, so remember that the right atrium actually has a higher pressure in the fetus than the left atrium. And also what we have over here is something called the foramen ovale. And the foramen ovale is going to be a hole in between the right and the left atrium. So this is very important because what it's doing is going to be our first adaptation to move blood away from the non-functional lungs at this point. We don't have to take this massive amount of blood and send it over to the lungs to get oxygen because it's already oxygenated. So this is one way that it can go in and kind of bypass the lungs, is through that foramen ovale, and that's what's happening right there. And again, the thing that does it is going to be that the right side of the heart is going to have a higher pressure than the left side of the heart in the fetus. So that helps move it from the right side to the left side. So you will have a small amount of blood that's going to enter the right ventricle, pumped to the pulmonary trunk. And then you have another shunt right here, this pulmonary, from the pulmonary trunk to the aorta, and that is called the ductus arteriosus. So again, so any blood that goes through the right atrium to the right ventricle into the pulmonary trunk, it's another way to bypass the lungs at this point. So that's another bypass that you have from the lungs. You do have a small amount of blood that's going to go to the lungs because the lungs still need to have blood so they can develop and mature like they need to. Otherwise, if it didn't get any blood, then of course that tissue would die. So we need to make sure that that tissue stays the way that stays healthy and gets plenty of blood that it needs to grow and to develop and mature. So let's take a look and see what happens. Number 5 right here. I know I skipped right through to number 6. There's a lot happening in this heart because there's so many ways that the blood can go. So I talked about how it can go from the right atrium to the right ventricle, pulmonary trunk. From the pulmonary trunk, a little bit goes to the lungs, but a lot of it's going to be shunted out through that ductus arteriosus into the aorta. Let's take a look and see what happens to the blood that goes from the right atrium to the left atrium. Well, it is going to be pumped into the left ventricle, and it's going to be pumped right into that aorta, just like our regular circulation from that way. And from there, blood's going to travel to the rest of the body. You have blood going up to the head. You have blood going down here. And then eventually, it is going to, of course, head back. Where is that? Yeah. So eventually from the iliacs, it's eventually going to turn into, or empty into, I guess I should say, the umbilical arteries. Remember, the umbilical arteries are going to have deoxygenated blood. They've picked up carbon dioxide. They've already dumped off their oxygen. It's going to be nutrient poor. From there, it's going to go back to the placenta and then, of course, back to the mother's circulation. So it can do that all over again. So there's those big bypasses that are going to happen. A lot of the fetal adaptations that are going to happen in the fetal circulation. So let's take a look and see what happens after birth, because there's no reason for all of this after birth. After birth, that newborn needs to be able to get oxygen from the air. It needs to be able to get nutrients. How, it will eventually, everybody gets nutrients, right, from eating. So let's take a look and see what happens to these structures. A lot of them just become ligaments. Look at that. The ductus arteriosus ligament, ligamentum arteriosum. Same thing with the ductus venosus, ligamentum venosum. The foramen ovale becomes that fossa ovalis, which is something that we talked about in the heart, one of the structures that was found in the atrium, between the two atria. It's going to be this really thin tissue that's going to close up the sides of the heart. And when this closes up, it changes the pressure. Look at that. Pressure on the right side of the heart decreases. So now we have a greater pressure on the left side of the heart, which is going to be what we normally find. Pulmonary arteries are going to dilate, and when they dilate, that pulmonary resistance drops. Exactly what we find in the pulmonary circulation, right? We have a lower pressure in the pulmonary circulation, and that's going to allow for all of those changes that are going to occur with the first breath. Umbilical arteries and veins are going to become, look, more ligaments here. So you just really have a lot of, all of these are going to kind of close up and just become ligaments. Let's take a look at one problem, one issue that might occur if these don't close up. So anytime that the ductus arteriopen stays open or patent, or the ductus venosus stays open or patent, or the foramen ovale stays open, that can cause issues. So it can lead to congenital heart defects. So here's one patent. A patent ductus arteriosus is going to be when the ductus arteriosus fails to close. So when it's open, what you have is the blood is flowing from the aorta, or the blood, that oxygenated blood from the aorta is able to enter the pulmonary system because you have this kind of pressure change that happens. So you have this high blood pressure in the pulmonary circulation, and you have this mixing of deoxygenated blood. So usually what they can do is they can go in and treat it with prostaglandin inhibiting medications. That's going to help go in and just close up that ductus arteriosus. Or if that doesn't work, then they will have to go in and do surgery. There's also, there's several congenital heart defects. So, and if you want to learn more about them, just, Google congenital heart defects. But there's another one called the atrial septal defect. That's going to be where the foramen ovale does not close, which is going to cause big issues as well. There's also one called the transposition of great arteries. That's where the pulmonary trunk is where the aorta is, and the aorta is where the pulmonary trunk is. So that is going to cause issues where the aorta is actually coming off of the right ventricle, and then the pulmonary trunk is coming off of the left ventricle. So that, as you can imagine, can cause issues as well. Think about what issues they're going to cause, those two that I just mentioned. So that is the last section of our chapter 20. So until next time.